My name is Harper Bishop. I'm the Economic and Climate Justice Coordinator for Open Buffalo. I'm pitching for Fran Gale R, the Executive Director of Open Buffalo, who's homesick but sends her well wishes to everyone and to our folks here at PolicyLink. So we're pleased that you could all join us this afternoon for the release of Health Equity, the Path to Inclusive Growth in Buffalo. This report was developed over the past 6 months by PolicyLink and the Program for Environmental and Regional Equity at USC, in partnership with Open Buffalo and its partners, the Partnership for Public Good, Push Buffalo, List Buffalo, Coalition for Economic Justice, and with support from the Robert Wood Johnson's Foundation. Even though she's not with us today, I want to acknowledge that this partnership began with Sarah Trueff and has continued under the leadership of Tracey Ross and the hard work and dedication of Angel Ross. So let's give them a round of applause. As you know, healthy and thriving cities begin with healthy residents. The dominant narrative says that healthy lifestyles, avoiding risky behaviors, and seeing a doctor on a regular basis result in healthy individuals. However, factors such as access to educational opportunities and high-quality jobs, the persistence of racial inequalities, and ecological degradation all play a role in healthy communities as well. The region's rich legacy and complex history have a direct connection to the current state of health in the city of Buffalo. At the beginning of the Great Depression, Buffalo had 573,000 inhabitants, making it the 13th largest city in the United States. Over the next 75 years, the city lost 55% of its population, a trend that lasted into the early part of the 21st century. Today, grassroots organizations are working hard. They're training leaders on the neighborhood level to create new models of neighborhood development, with community control as a core value, promoting safe and walkable neighborhoods, seeding new consumer and worker cooperatives, advocating for high quality and sustainable job creation, and initiating community-based solar and geothermal projects that are helping to create a new architecture of energy. This mission is to create a more equitable and sustainable Buffalo for all. Since 2015, Open Buffalo and its partners have been organizing with resident leaders in our city's Fruit Belt neighborhood to ensure that the community benefits from economic development programs and projects through quality jobs, education and training, local and minority business opportunities, and green operations. We have started with an initial focus on the Buffalo Niagara Medical Campus because of its symbolism as the epicenter of Buffalo's economic resurgence and the promise of the new Buffalo. However, it's unclear at this moment whether that promise will come to fruition as rapid gentrification is displacing longtime residents. And displacing longtime residents, and the parallel reality being faced in this neighborhood like the Fruit Belt is akin to a tale of two cities. That's why we're committed to change at the neighborhood level. Guided by the vision of fostering democratic participation in community wealth building strategies, the Fruit Belt community has worked over the past year to create the first community land trust in the city of Buffalo. It will serve as a model for other neighborhoods and communities facing similar challenges and be a model of what a regenerative economy looks like. It's our firm belief that Buffalo's greatest days are ahead of us, and that a rising tide should lift all boats. We're creating a movement toward a resilient economy that is place-based and people-focused. Our communities and their health are paramount in securing that beautiful and bold vision. With that, I'd like to turn it over to Council Majority Leader and Niagara District Council Member and good friend of mine, David A. Rivera. For some remarks.
Thank you very much. First of all, I want to thank Open Buffalo for convening this meeting today. I want to thank the local experts that are here and have participated. Commissioner Burstein, Jessica Bauer Walker, Sam Magavern, Dr. Samina Raja. We are fortunate to have these established experts of our own. I'd also like to thank Tracey Ross from PolicyLink for coming to Buffalo and bringing a well-prepared report needed for the next steps in Buffalo to ensure progress that is felt across the entire city. One of the recommendations that is in the report is a hot-button issue on the Common Council, to say the least, and that is inclusionary zoning. Inclusionary zoning came before us during the Green Code process. approximately 300 people commented. It was the second most commented item in the Green Code. Since then, 300 people have come to council chambers to talk about their concerns. And I just had to listen to some of the stories that came before the Common Council of people that were being displaced from neighborhoods that they grew up in, recreated in, their families live in, and had to move simply because a new owner came in and doubled the rent and they had to leave. Moving to further parts, the fringes of the city of Buffalo, segregating them into different parts of the city. The Common Council came together and asked our Office of Strategic Planning to come up with a policy to deal with affordable housing in the city of Buffalo. They hired a consultant. The consultant was to report to us back in February and January, and here we are in May. For some unknown reason, they have not come forward with the numbers and the reports that they have. And this council is going to continue to, wherever we have an audience, to request that they provide us with the information that they hired the consultant. And so we need to rely on experts like yourselves. And I thank you that you have come here to Buffalo. And while we have 3 reports already, we still have not received a report from the city of Buffalo. And I'm the majority leader of the city of Buffalo, and the council president has filed a resolution asking for inclusionary zoning. We will continue to advocate for it. So today I'm looking forward to listening to the response of the panelists, to the great questions that I know are going to be coming from the audience. And we understand that the city of Buffalo is going through a renaissance. And as you mentioned during the beginning, we want to raise all boats. And we don't want to alarm the developers, investors that are in the city of Buffalo. We want to work with you to make inclusionary zoning work. You know, sometimes they put up a wall even before we look at the information. So we're going to work with the investors, the developers, to come up with numbers that work. There's no doubt in my mind if we come together, as complicated as it is, and sometimes they make it so complicated to confuse you, we're going to hold them accountable, and we're going to look at the numbers to make sure that the numbers work. So thank you very much for coming today. I'm looking forward to listening to the conversation. Thank you.
Good afternoon, everyone. I'm Sam Magavern, Director of Partnership for the Public Good. Thank you all for coming. I'm going to introduce our friends from PolicyLink, and then they will present their findings for us. Tracey Ross is the Associate Director of the All-In Cities Initiative at PolicyLink, which works with cities across the country to adopt policies and practices that promote equitable growth. Prior to joining PolicyLink, Tracey worked at the Center for American Progress, focused on urban poverty and environmental justice, and at Living Cities on place-based efforts. Her writing has appeared in the Washington Post, The Root, The Nation, Ebony.com, and Think Progress. Angel Ross, Research Associate at PolicyLink, works on the Equitable Economy team, focusing on the National Equity Atlas and using data to build the case for equity and inclusion. Prior to joining PolicyLink, Angel held research positions at the Center for Community Innovation at UC Berkeley and the Haas Institute for a Fair and Inclusive Society. So I want to thank you both for the great report and for spending time in Buffalo. I know those of us who have had a chance to work with you have learned a lot already and look forward to learning more. So thank you so much, and take it away.
Thank you so much for that introduction, and thank you for having me here. I want to start by just saying a little bit more about what PolicyLink is. So we are a research and action institute. We call ourselves that because think tank is a very passive kind of way of describing institutions. I worked at think tanks in Washington, D.C., so I was happy to join a research and action institute based in my hometown of Oakland, California. And so I'm happy to be here specifically in Buffalo, because we had a wonderful conversation earlier today about why we're excited about work in Buffalo. I think Buffalo is a place where, similar to Oakland, my hometown, you can tell it has a soul. You know, a lot of places, cities that I work in, I go across the country, there's, I think the identity, you can tell things are changing and things are, there's a lot of anxiety about the changes that are going on, but in Buffalo, the soul is intact. You can tell that the people care about this place in a way that it's not surface level, it's in the fiber of everything that you all do. And the work of the organizations here is very impressive. There's high capacity, really innovative work going on. And so as someone that manages a national initiative, I'm excited about the fact that we get to take some of the best practices that we're learning about here to other places and say, well, this is how they do it in Buffalo. So that's one of the reasons why I've been excited to be a part of this work. So I'll just briefly tell you also about what the All in Cities initiative is that I manage. So All in Cities initiative was created in response to the fact that cities are changing, that more people are attracted to cities, young people, businesses, investors want to move to cities more than ever. You know, there's this reverse from going to the suburbs. At the same time, the people who were dedicated to being in cities during their long decline aren't benefiting. People of color, low-income people particularly. So the All in Cities initiative was created in response to this and saying that we're going to work with leaders inside city government and outside city government to add research, data, capacity, technical assistance to help create policy agendas to make sure that we're connecting people of color and low-income people to opportunity as cities are changing. We got a particular grant through the Robert Wood Johnson Foundation to focus on a series of reports on health equity. So that's what brought us to Buffalo, was the fact that your zip code has more of an impact on your life expectancy than your genetic code. And so that's really what this report is about, is that where you live matters, and that if a child from a low-income family is born in one of your more prosperous neighborhoods here, they're going to have, you know, much more chances and opportunity in life. That same family, if they're living in the fruit belt and a child born, same family, same income, their life chances are completely different. And how that is a huge problem, particularly in a place where you have world-class health institutions. So that's really what this report is. It's about, you know, highlighting these health disparities. And we're excited also because, as the councilman mentioned, there have been several reports. You know, our report isn't new. You know, we're the outsiders. We're not the experts on Buffalo by any means, and we don't pretend to be. But this report, we really wanted to make sure that we were highlighting the work that's already been going on and bringing in our outside perspective to affirm a lot of the work that's already been going on. To say that as a national initiative, we see that there are some health disparities that really shouldn't exist in this community. And so that's what this report is about. It's complementary also to the work that that was done with the Racial Equity Dividend Report. While that report had kind of a regional focus, we're focused mostly on this report in Buffalo itself, and using this health equity lens that I mentioned. But we see this as very complementary to the work that has been going on. So health equity, I've mentioned that a couple of times. Like I said, your zip code has more of an impact on your life expectancy than your genetic code because of the air you breathe in a particular neighborhood. You know, if you're in the fruit belt, you're inhaling more pollution than if you're living in a more prosperous neighborhood across the city. You have less access to grocery stores with fresh and healthy foods. And this is a problem that in communities across the country, people don't get access to healthy foods, fresh air, all the resources you need until a certain type of person has an interest in that neighborhood. You know, this report isn't about blaming any one community, but it's about highlighting the fact that regardless of your background, regardless of your income level, everyone should have access to a healthy living environment. So that's what the report underscores. So again, we're outsiders. We never pretend to be experts on a place. I'm not an expert on Buffalo. I'm an expert on urban policy issues and environmental justice. I will say again, I'm not an expert on Buffalo. So what we did when we came here, we did a site visit, we spent time in the Fruit Belt neighborhood, we spent time in the West End, we did interviews with a number of community activists, organizations, members of the government, to get a better sense of what the priorities are, what momentum is going on in the city around certain issues, the political context. And we use this to really highlight a lot of the data that we did. We're also, like I said, we're not Buffalo experts, but we are data experts. So we have a wealth of data that we're able to share about your community. But we did the site visits first to just better understand the political context, because data is important, but we need to understand how people are living to illuminate the data. So that was the process, and in terms of the recommendations, we wanted to prioritize, well, what are priorities to residents? Where is their momentum? How can we leverage the anchor institutions, so the universities and hospitals? And where has there been some successes already? So that's how we landed on the recommendations for the report. So I'll briefly talk about some of the recommendations. First category is, and if you hadn't gotten a chance to get the report, there are copies on the front table. The first category of recommendations is making sure that all neighborhoods are healthy communities of opportunity. So the councilman discussed one of the most important recommendations of the report, inclusionary zoning. This is something to just make sure that people are able to have affordable housing throughout the city, that we're not making it a luxury to be able to survive and thrive in Buffalo. Also the creation of community land trusts. I know there's a lot of momentum around that. We also, I think one of the most important recommendations that we discuss is access to reliable transportation. 42%, and my colleague Angel will go into this, about 42%, right, of people of color in the city do not have access to a car. And we know that from a number of national studies that transportation has more of an impact on social mobility than neighborhood crime, than even elementary test scores. Transportation is that important. So the fact that we had a wonderful conversation with John Washington about having to wait an hour or more for one bus and then having to transfer, and just the time penalty, the amount of time spent just trying to live your life and thrive in the city is something that is holding people down. So we go into that in the report. We also talk about, as I mentioned, there are world-class health institutions that are, right down the road. That the Fruit Belt in particular is in the shadows of these health institutions. There's a number of things that can be done in terms of more access to having community health workers in the neighborhoods, making sure that they're investing in the health of the neighborhood, and making sure that there's pathways to jobs. There's wonderful models around the country. Boston has a great model because they have so many universities and hospitals as well, about creating career pathways, training programs, so that if you're going to have institutions like this, neighborhood residents should have access to jobs and career pathways. There's custodial services, there's everything from front desk workers, there's ways to advance your career and get more education by being sponsored by the hospitals. So our report touches on a variety of these issues. So I know that there have been many reports that have already been released. So some of these recommendations are not new, they're not surprising. So the wonderful thing about coming in as a national organization and wanting to do recommendations is some of the stuff that's like, well, that's already been said. Some places when we make these recommendations, it's entirely new. The recommendations in this report, they aren't entirely new. They've been discussed, and they will probably be discussed by the panel today. But we were happy to be able to be that outsider affirming what the work that's already being done on the ground by all of the local leaders, and to really recognize that we're bringing in this wealth of data that's focused on health equity, and the leaders here are already doing what needs to be done. It's just about, will leadership inside city government, will leadership inside the big institutions really work with the leaders doing the hard work and the momentum that's building. So I hope that this report helps provide greater perspective on what it means to have a healthy Buffalo. But again, you won't be surprised by the recommendations, because you have wonderful leaders in this community that are actually teaching us a lot about how to get this work done And what will really matter going forward is for the resources to be there, for the political will to be there. But we're really happy to continue to partner with Open Buffalo, Push Buffalo, the organizations present today. My colleague Angel will actually now give you a presentation that dives into this data. I just wanted to provide an overview, a tease for what this is. But we have two reports. So this is the digestible report, which is online, about 19 pages. Angel is going to walk you through the 120-page report, not all 120 pages, but the 120 pages worth of data that this just highlights. So I just want to thank you all, and especially thanks to Harper for all of their leadership in all of this work, and for being just a tireless servant to the Buffalo community and the Fruit Belt in particular. Thank you all.
Thank you, Tracey. So as Tracey mentioned, my name is Angel, and I'm going to go over some of the highlights from that longer 100+ page equity profile. And then the next panel will kind of delve into some of the local implications of this data. So we produced a data equity profile, Harper mentioned, with our partners at the Program for Environmental and Regional Equity, or PEER, at USC. And we started a long-term partnership with PEER because of an analysis a few years ago that looked at the economic benefits of equity. So I'm sure most of the folks in this room probably understand the moral imperative of equity. And while the moral imperative is always central in the work that we do at PolicyLink, there's also an economic imperative. And this is what we mean at PolicyLink by, let's see. This cursor is a little bit, doesn't really like to move where you want it to. So maybe we should try the arrows are not working. It's usually a little. Yeah, it's on there. Okay, well hopefully we can get it to work at some point, because it's kind of hard to talk about data if you can't see the charts. Let's see. Okay, I don't know what I did, but now it's working. So I'm just going to try to hold my breath and hope that stays. Okay, so this is what we mean at PolicyLink when we talk about equity being the superior growth model. There's actually been a growing consensus among economists that more equitable regions experience more sustainable economic growth. So when we talk about equity at PolicyLink, we talk about it as the antidote to inequality. And to show this, with PEER, we did an analysis of the largest 150 metro areas in the United States to see how much greater their regional GDPs would be if we were to close racial gaps in income. And in fact, in all 150 regions, eliminating racial gaps in income boosted the entire economy. And I'm going to show the numbers for the Buffalo metro area in just a second, but first I want to provide a really quick overview of the database that this profile draws on. PEER manages our Regional Equity Indicators database. It covers the largest 150 metro areas, the 100 largest cities, all 50 states, and the United States as a whole. It pulls from a variety of different public and private data sources. I think I got it, yeah. I don't know what I did, but one of the buttons on the press worked, so thank you. Pulls from a variety of different public and private data sources, including microdata from IPUMS, the Behavioral Risk Factor Surveillance Survey from the CDC, and a host of different economic, education, and environmental data sets. So Tracey mentioned this profile is focusing specifically on the city of Buffalo, and all of the data presented, unless otherwise noted, actually follows this city boundary. I'm going to go through some of the data highlights, but our intention is really not to get stuck in the data, but to have it inform broader policy conversations. If you're interested in a longer data and methods section. All that is available in the profile online. And also on the National Equity Atlas, we have regional data in addition to the city data if you want to compare the city to the region. So what is an equitable city? We define equitable cities where all residents, regardless of their race, ethnicity, income, neighborhood of residence, and other characteristics, are fully able to participate in the city's economic vitality, contribute to the city's readiness for the future, and connect to assets and opportunities throughout the region. And Tracey mentioned that this profile and engagement was also funded by the Robert Wood Johnson Foundation, so we really honed in our health analysis throughout the profile. And health equity, as defined by the Robert Wood Johnson Foundation, means that everyone has a just and fair opportunity to be healthy, and this requires removing obstacles to health like poverty, discrimination, powerlessness, access to good jobs with fair pay, quality housing, education, safe environments, as well as healthcare. So when we talk about health equity, what we're really talking about are what public health researchers refer to as the social determinants of health, or everything outside of the healthcare system that impacts people's health outcomes. And this really comes through with the framework that you'll see in the profile that drove the data analysis. We examine indicators across 3 major buckets: economic vitality, which looks at things like unemployment and income; readiness, which looks at the human capital within the region, things like education and health insurance coverage; and lastly, connectedness, which looks at how well are residents connected to each other and to regional opportunities. We also look at the demographics in the region, and closing out the profile with the economic benefits to the broader economy of racial economic inclusion. So I'm going to go through some of the findings, but if you want more, again, it's like 100+ page report to look through all the different findings that we went through. So first, looking specifically at the Buffalo metro area, we see that the equity dividend, or the projected boost in GDP from racial equity, was over $4 billion in the metro area in 2014 alone. So over $4 billion in 2014 alone. And we calculate this by projecting what the GDP would be if all racial and ethnic groups had the same age-adjusted income distribution as non-Hispanic whites. So the Buffalo region really has a lot to gain in economic terms from racial economic inclusion, and we know that racial inequities actually limit economic prosperity not just for people of color, but for the region as a whole. And this equity dividend is likely to continue growing because, as folks probably know, the city's demographics are changing. And this is showing the growth rates for the major race and ethnic groups from 2000 to 2014. Even though the US-born Black and white populations declined considerably in Buffalo from 2000 to 2014, the Asian or Pacific Islander immigrant and Black immigrant populations more than tripled in the city, collectively adding over 10,000 residents. The US-born Latino population added another 5,000 residents over the same time period. So even though Buffalo is still largely a Black and white city with a declining population, this is changing as communities of color are buffering overall population loss and changing the demographics of the city as a whole. Moving on to some of the equity indicator highlights. Councilmember Rivera spoke about some of the housing challenges facing Buffalo, and we also saw this in the data. So even though Buffalo is considered more affordable in absolute terms than other regions in the state, Buffalo actually has a higher renter housing burden than New York City. So a greater share of households here are paying more than 30% of their income on rent. So again,
right.
What was that?
That ain't right.
So Buffalo has higher renter housing burden than New York City. And this has to do with the fact that no matter how relatively affordable the housing is, if folks here do not have the cash to pay for it, it's not going to be affordable, right, for folks living here. So among renter households that you'll see on the left, 64% of Latino households and 61% of Black households who are renting are paying more than 30% of their income on rents. Among homeowner households, the burdens are a little bit lower, but Black households are still more likely than white households to be cost burdened. And we also see that there's lower homeownership rates, right, within the Black population and the Latino populations than the white populations, and we know that homeownership is a huge contributor to the racial wealth gap. So why might these housing burdens be so high? One, we see that black unemployment is more than double the white unemployment rate. And we see racial disparities even when controlling for education like we do here. So you see an unemployment rate by educational attainment. Unemployment rates are highest among the population with less than a high school diploma, but the black population is still more likely to be unemployed regardless of education level. In fact, black workers with a high school diploma are as likely as white workers without one to be unemployed. And even among the most educated workers, right, on this side, those with a BA are higher, black unemployment is higher than white unemployment. There's also a considerable drop you'll see in black unemployment associated with a bachelor's degree. So black unemployment drops 10 percentage points among those with a bachelor's degree compared to those with an associate's degree. And whereas in the white population, it only drops 3 percentage points. We also found that the jobs that folks of color have are less likely to pay family supporting wages. So we define working poverty as the share of 25 to 64-year-olds who are working full-time and have a family income less than 200% of poverty. And we use 200% of poverty because the federal poverty level is so low. So for a family of 4, that 200% is less than $48,000 a year, which is less than a living wage for the region according to the MIT Living Wage Calculator. So the working poor rates you see are highest for the Asian or Pacific Islander population. 1 in 5 Asian or Pacific Islander residents in the city, ages 25 to 64, are working full-time and have a family income less than 200% of poverty, as are 18% of black and Latino residents. And this compares to 7% of white residents. You can see that white working poverty has actually declined since 2000, while it's increased for people of color. So tackling high unemployment does not mean reaching economic security if the jobs that folks are getting are not paying family supporting wages. We also looked at the share of the population living in what the Reinvestment Fund refers to as limited supermarket access areas. LSAs are defined as census tracts where residents must travel farther than other residents in well-served areas to get access to healthy food. And they control for population density and car ownership rates. And we see here that long bar is the share of black residents who are living in these limited supermarket access areas. So black residents are 6 times as likely as white residents to live in LSAs and 9 times as likely as Latino and Asian residents. All right, so while genetics matter when it comes to health, we also know that these social and environmental factors also play a really important role in health outcomes. And then closing out with some of the transportation indicators that we looked at, another important component of a healthy neighborhood is mobility. So we looked at the share of the population using public transit to get to work by annual earnings. And we found that it's not just that low-income folks are more likely to rely on transit, because we see that even among workers who make less than $15,000 a year, black workers are nearly 4 times as likely as white workers to take public transit to work. And even among middle-income workers, the $35,000 to $65,000 per year, middle-income black workers are 7 times as likely as their white counterparts to take transit. So even when controlling for income, right, we see that black workers are more likely to rely on transit. And there are real cost implications here when it comes to commute times. Unsurprisingly, probably to folks, the commute times of bus riders are significantly higher than the commute times of drivers. But even within bus riders, Latino and black riders have the longest commutes, and some researchers refer to this as the travel time penalty. So when we looked at this annually, we found that the average black worker who rides the bus spends 59 more hours in transit each year. That's more than an entire work week compared to white bus riders, and 174 more hours, or 4 entire work weeks more compared to those who drive. And it's even a more transit penalty for Latino workers. So Latino workers who ride the bus spend 195 hours more, or almost 5 whole work weeks more than those who drive. So, and this is time lost, right? Like time lost not earning wages, not caring for family, not engaging in leisure activities. So improving bus service in the city, particularly because, as Tracey mentioned, more than 2 in 5 Black and Latino households do not have access to a car is really central to increasing access to opportunities for all residents in the city. So earlier I mentioned that the region's GDP stands to gain over $4 billion a year from racial equity, which is an 8% increase. When we also look at this percentage gain in average income with racial equity for each race and ethnic group in the city and also in the broader region. So in the city, average Asian or Pacific Islander income would grow at would more than double actually on average, so 127% increase. Latino income would almost double in the city at 98%, and average Black income would grow by 57%. Black income would grow faster at the regional level than it would at the city level, while the opposite is true for Latinos and Asian or Pacific Islanders. And the majority of these gains across the board would actually come from closing employment gaps with white workers. So with new investments coming into the city and the economy continuing to rebound, the city really has an opportunity to put itself on a path towards inclusive growth and prosperity and create a city where all residents are able to participate into the economy, to prosper, and to reach their full potential. So I've thrown a lot of data at you all this morning. Thank you for bearing with me. There's even longer data profile that you can find online. But we know that data just by itself in a report is not that powerful. But advocates and city officials, elected officials, and organizers that are equipped with good data can be transformative. So our goal is that this data profile be used as an additional tool for advocacy and policy change moving forward. Thank you all, and if you want to look up the long 100+ page document, you can find it at the nationalequityatlas.org. If you also want to send in, the report that Tracey wrote that everyone should have a printed out copy of, you'll also find that there in the report section of the website. So thank you.
Discussion, and then we'll have Q&A, and I think you've got or are getting index cards that you can put down questions for the Q&A, and those can be for members of the panel or for Angel or Tracey, if you have questions for any of us. So as I said, I'm Sam Magavern in Partnership for the Public Good, and I want to introduce our panelists today. So Dr. Samina Raja is a professor at UP. She's one of the foremost experts in the whole world on food justice and food systems. So very excited to have her with us. Jessica Bauer Walker is founder and executive director of Community Health Worker Network of Buffalo. She is also in an official position with the District Parent Coordinating Council, active on a lot of other projects, and really the person who brought the concept of community health worker to the spotlight here in Buffalo. Dr. Gale Burstein is our Commissioner of Health for Erie County. She is one of our very most tireless and dedicated public officials. I read a profile of her in the Buffalo News and learned that she sleeps half the number of hours each night that I do, so I'm just in awe of how much she gets done. And Dennice Barr is president of the Fruit Belt Advisory Council. She serves on the board of the Buffalo Parent Teacher Organization, Coalition for Economic Justice, and is another person who can be found wherever community events are happening, wherever important discussions are taking place. You will find Ms. Barr there. So really delighted to have all of them. I'm going to ask them each to talk for about 3 minutes about some of the work that they do that involves health equity, and then I'll pose 2 questions to them probably, and then we'll do the questions from you. So I thought we'd start with Jessica because her work around health equity has really helped to kind of enlarge our vocabulary here in Buffalo. She's really done a lot to educate the community about social determinants of health, which you heard from Tracey and Angel, and what those mean, how community health workers address them, what it means to do asset-based community development. So can you explain all of that in 3 minutes?
Do my best. Good afternoon, everybody. Okay, we can do better. We have school, right? Good afternoon, everybody. Good afternoon. Much better, thank you. Again, I'm Dennice Bauer Walker. I'm the director of the Community Health Worker Network of Buffalo. I also do community health worker work myself at healthcare and in the Buffalo Public Schools. So social determinants of health, which you heard mentioned in the report there, this is really the framework. And how many people have heard of social determinants of health? Is that language familiar to about half the people? Okay. So social determinants of health are those factors where we live, work, go to school, play, that really impact our health. A lot of times we say community health workers and people say community health care workers. And we have to go back and say, no, it's actually health, which is a much broader construct, right? So the framing for the data was very useful for us to expand what we're thinking about when we talk about health. So those are those social factors like transportation, like places to get fresh fruits and vegetables, like access to quality education and jobs that really impact our health status. Community health workers. How many folks have heard of community health workers? Okay, how many people are community health workers? Are they trained as community health workers? I see a lot of my people in the house. Awesome, thank you. And we have folks who work as community health workers. We also have some people in this room who are community organizers, who are school nurses, who are administrators in different places, who have been through community health worker training to have this context and to work in partnership with the community. We've trained more than 400 folks as community health workers and done a lot of work around cultural competency training as well. The definition of community health workers is people who are of and from the communities that they serve or have very close and trusting relationships with those communities. So have spent time out in the trenches, developing those relationships, really understanding the community fabric. We find that that's critically important, especially in healthcare and public health and education, because a lot of times folks who are coming into our communities don't have the context of social determinants of health that we do, living and working in our communities. So I do a lot of my community health worker work in Buffalo Public Schools because I'm a parent in Buffalo Public Schools. And a lot of it on the west side because I'm in the west side, right? So I have that community connection, and we have a network of folks here in Buffalo who are embedded in their communities, who've been trained through our 28-hour, 4-day program, giving them a set of core competencies, understanding what public health and healthcare is, understanding the intersections with social determinants of health, and doing things like having a strengths-based approach. So Sam had asked me to speak to asset-based community development as well, which is really key with what we do in the Community Health Worker Network, and is really our core community organizing strategy. Because we believe that this community has tremendous strengths and assets. There's a lot of needs as well, right? So it's important for us to understand what the needs are, so we know what we're up against, but to also understand that there is incredible assets in our community. And those primary assets are really the people that are there, right? So we want to ensure that when we're building this big Buffalo Niagara Medical Campus and we're working on tackling things like health disparities, that we're empowering folks that are out there, that are on the ground, to take charge of those issues, right? That it's our infrastructures, but it's also our people on the ground that have a lot of power. We should be mobilizing those folks. We should be taking advantage of all that they bring to the table and trying to tie together those social determinants of health, using people who are of and from the communities, and really building on strengths so that we have a stronger and healthier Buffalo. Okay.
All right, Dr. Gale Burstein, as Commissioner of Health for Erie County, you've really embraced the social determinants of health approach. You've really made health equity a hallmark of what you're passionate about. Can you talk a little bit about the county's role in addressing these things?
Sure. So thanks. Yeah. Hi, my name is Gale Burstein. I'm the Erie County Health Commissioner, and I'm also a pediatrician and clinical professor at UB School of Medicine. And I'm also a Buffalo native. Sam and I went to high school together a long time ago. So I just want to talk about how how we approach health disparities or health inequity. And we know that in our community, I mean, that's why we're all here, is that we are all struggling with many health disparities. But it's not really a homogeneous issue. I mean, there are disparities in many different populations. I mean, there's health disparities by race, there's health disparities by gender, there's health disparities by neighborhood, there's health disparities by socioeconomic status, there's health disparities by sexual behavior. So, I mean, we know that there are just many different health disparities that we're struggling with, that we're, trying to, rein in and trying to address. So some examples with, I think, our biggest challenges that I think you're all aware of is, we're struggling with lead is a big health disparity, and it's really focused on certain neighborhoods, certain zip codes, and many of those zip codes are defined by poverty. The families there are mostly people of color, and so we're helping. We have many outside resources, funding from CDC, funding from the state, lots of funding from HUD to try to address that. Another disparity that we see that we're struggling with is unintended teen pregnancy. Again, that is a challenge because we know that it really limits kind of the academic and financial abilities of these mostly young women who are really challenged with trying to be economically and financially successful when at a very young age they're raising a young child, sometimes with help, sometimes without very much support. So again, we want to help them achieve their goal and have control their fertility and be able to decide when they want to start raising a family. We have disparities, huge disparities with sexually transmitted infections in our community. And again, that's just defined by gender, those disparities. It's defined by race. It's defined by neighborhood. We see many of our STDs, we map them out in in specific zip codes, and most of those are really in the city of Buffalo. So, and also that's with sexual behavior. We see, especially a lot of our new HIV infections are among men who have sex with men. So we're again putting in a lot of resources to try to limit that. With the teen pregnancy, we have a large grant with they came to Erie County, partnering with Trickatelli Associates through the Office of Adolescent Health. We have $10 million over 5 years. But again, that is what we're doing to spend that money, is trying to bring the community together, bring in leadership to make changes in our community. Just because, again, in all of these, we're working on all these different health problems. But again, if we look at just focusing on a specific health issue without seeing the big picture, we're just putting a Band-Aid on the whole situation. And so we know that really the largest determinant of health is the social determinants of health. So getting people access to healthy food, getting people access to safe homes that are lead-free, getting people access to contraception if they choose to access that. So it's again getting people access to education, getting people to access to transportation. Again, those are all the social determinants of health, and we know from good research and evidence-based, and also looking at case studies that is really what's going to turn the corner in our health disparities. So in the health department, we can't do that all. We don't have a control a lot of those factors. So that's why what we're really trying to do is focus on partnerships of people in the community that can make those changes and can turn it around. And so that's where we're really trying to devote a lot of our work. In addition to abating the lead and to to helping out with just increasing access to healthcare and family planning. We're also trying to work with our partners to try to change the game and make our community healthier by improving the social determinants of health. So thanks.
Dr. Raja, talk to us about food.
I like food. Nice to see you all. It's nice to see some familiar faces and some new faces. I just want to acknowledge, first of all, PolicyLink for doing the work that they did for us. Thank you very much. I also want to acknowledge the history of PolicyLink with Buffalo. For those of you who may not know, we have actually made strides around food justice and food policy to some degree, even though we have a long way to go, and PolicyLink played a role in that. When we inaugurated our Food Policy Council with the support of Commissioner Burstein, PolicyLink was here bringing us examples from around the country. So just want to acknowledge that. Thank you. So even though I was charged to talk about food, if I may, I'm going to deviate a little. I'm a planner by training and a civil engineer by training. And I was born in a place called Kashmir, which is a disputed part of the world. And mountainous, beautiful place. It's got all the resources in the world. But I can tell you that the likelihood of a young boy living to adulthood are minimal. They get shot dead, arrested, or disappeared, and they don't live their life to fruition. So I've seen places fall apart in ways that I would not wish on any place. I chose to call Buffalo home in 2001 for the same reason that I heard Tracey mention, which is that this place really adopts you, whether you like it or not. People adopt you. And so I'm very proud to call this place my home. I came here for a job, but it wasn't really the job. It was the people I met during my visit, and I was really moved by the history of this place. Anyway, so that's a little background to say, trained as a planner and an engineer, but the fundamental question I actually ask is why bother planning? Why bother building? Why do we do it? Not because we like to build or plan, but there's got to be some end game for why we do that. City building and planning actually came to be because we want to create well-being for people. And I want to make sure we, all of us, now and beyond, remember that health is not about the absence of disease. It's really about well-being. It's about being able to live your life to the fullest, to grow up as full functioning adults, to have jobs, to have lives that we enjoy and find purpose in. Not about whether we are going to make it to our asthma appointment or not. Really, we unfortunately in Buffalo are still struggling with the very, very fundamental problems and not getting to a place where we need to be about full life. Even though I'm known for food work here, which I'm happy to be, my work actually is about planning and health. And so I want to take a second to just talk about that. If in planning cities and communities and neighborhoods, we're not creating places of well-being, either through food or through other ways, then we ought not to be calling it planning and public policy. It's something else. But it's not planning and public policy. There's a reason why planning and public policy came to be, and health really was intended to be the driver. Sadly, of course, for me, over the years, over the decades, planners professionally have thought about, they do think about transportation, not in the ways we would like them to, but not in the ways, but they haven't necessarily thought about the one thing that people need, and I argue food, but only because food is a proxy for other things. We all eat food and we don't have access to it equally, and we saw the data on that. But there's something else going on, and it's not just about food disparity. It's about our collective, including Buffalo's dependence on the food system, but not giving authority back to the people who are actually running that food system. So we eat because people of color are actually holding jobs in that food system. They are working in the kitchens and they are growing our food and they are working in the farm fields, but we are unwilling to look at that. So even though I agree that nutrition and access to food is important, I think access, controlling the means of production is really much more important. And I'm sad that we're still in a place that we have such a disparity among African American populations and access to supermarket. And I'll just say that it's even more depressing than that, because the data that when we unpack it, that access is not just about lower income populations and higher income higher income white populations. Even when we control the data for wealth, so you could be looking at the same level of income in black neighborhoods and same level of income in white neighborhoods, you still see a disparity in supermarkets. So it's not just about economics, there's blatantly something else going on. And our regulators and planners and city officials need to step in and do something about that. So I guess I would say that from a health equity point of view, I'd urge all of us, including myself, to think about food sovereignty and food justice and control over means of production rather than thinking about how do we provide for, say, by the creation of a supermarket. That's just insufficient. We have an opportunity to go in a very different direction. The cool thing about Buffalo is that we do have a fabric fundamentally of people, but also other stuff historically. We have a lot of small businesses that have been run by people of color. We tend not to recognize them. We tend not to shore them up. So from a food equity point of view, I think we have to link business development in neighborhoods of color to food equity. Then we're increasing both sources of income to procure good food and also making sure there's a supply of good food. It can't be devoid of that. And then one final comment I guess I would make is that the conversation that we're having here is, even though it's sobering, it's also super exciting because I agree with Tracey that Buffalo is doing things very differently. We don't have a lot of resources as a city collectively, but we are paying attention to conversations about economic justice and transportation justice and housing justice more, I would say, than, say, cities of Portland, Seattle. We're very resource rich, so we ought to give ourselves a pat on the back for that. I think 2 weeks ago, I had a visitor from World Health Organization in Geneva, and she was talking about, I serve on a commission for WHO that is going to, for the first time in history, release a report that says housing matters for health. So they were here, she was here to give a keynote, and I said, can I please take you around to Buffalo? So I took her to the west side. I had her meet Erin Bartley and showed her some of the work that Push has been doing. And she said, wow, we ought to be talking about what Buffalo is doing nationally. So I just want to acknowledge that we have some of those great examples, and thank you for doing that.
The Fruit Belt neighborhood could be described as a place where Buffalo's past and its future are colliding right now. It's a neighborhood that's seen some of the worst challenges from depopulation, from redlining, from segregation, and you can see that in the over 200 vacant lots that the city owns in the Fruit Belt neighborhood alone. And now it's seeing this sort of new Buffalo eds and meds loom up, right next door to it in the medical campus, and facing challenges of parking, facing challenges of gentrification coming from that new development. So it's seeing challenges from the old, now it's getting challenges from the new. There was never sort of a happy medium in between. Luckily, it's a neighborhood with some really incredible resident leaders who have been working to address those challenges. And Dennice Barr is one of them. Dennice, talk to us a little bit about the strategies your neighborhood is pursuing.
All right, I'm going to get up just because, first of all, I'm at that age where I don't need to be sitting too much. And secondly, because I need to be standing up for my neighborhood wherever I go. You got to bear with me for a second, because I take public transportation. I'm on my way from downtown. I'm trying to catch the bus to get over close to here so I can catch another bus. And I'm standing around and I'm just observing. And I look and I see this sign on this building that tells me there are condominiums available that are $215,000 to over $300,000 in this building. And in my head, I'm standing there and I'm thinking to myself, what kind of job would someone need to have? What would it take for someone in my neighborhood? It's a historic neighborhood. These are the Bethlehem Steel workers. They're from that era. These are people that worked hard and they put their time and their value into the city to buy properties and to live in a neighborhood where in their becoming aged, they got redlined and cut off and pushed back to the point of where there was no plan for my neighborhood. There's only a plan for what goes on around my neighborhood. And that's a huge issue for me. You know, when you talk about things like food issues and transportation issues, and these are things that we live and deal with every single day, trying to survive in a community that's labeled as historic and yet pushed back and not being looked at as something that is valuable to the city. There lays part of our fight to say, you know what, we're valuable, and whatever we have to do to let people know that this community is important, then that's what we continue to do. We have come together as people, organizations from organizations, residents all around my neighborhood and my community to form Community First Alliance. We have formed the Food Belt Advisory Council. We are working together and have been consistently working together for years at a time when people would tell you that my neighborhood is in a state of chaos all the time, in calamity, where people don't work together. It is not true. And it is so unfair for us to be put into that limelight and to be made to look like we cannot collaborate, we cannot partner, we don't know how to bring success to our neighborhood. It's just so unfair. But here lies the bigger problem for me. Finding myself in the crux of all of this fight, I've dedicated myself because these people that I have grown up around who really put this neighborhood together the way it has been in terms of being mostly residential, all of this development that's coming, we want development. We keep telling people it's not that we don't want development. We want development. But we want development that's not going to push these people out of their properties. They have been there. I have neighbors that have been there for more than 70 years. And I am going to fight every single day to make sure that those people stay in their houses. They don't get pushed out because the taxes are going to go up around them. They don't get pushed out because all this development is coming and now our houses don't look like what's coming anymore. That's not what we're going to endorse. We need for people to understand that we're not going anywhere. You know, I'm upset about the fact that, and for those of you, and many of you are here that partner with me, you know I talk about the wall. And the wall is when we hit down off of Michigan and hitting into Main Street, where we recognize that there is no benefit for us. They get funding, they get tax breaks, they don't pay any taxes, they get everything. And that's great, but when it doesn't benefit the community that you are shadowing, that's a shame. That's not right. And that is something that we're going to continue to fight against, because we deserve everything that everybody else in this city is getting. And to say that it's okay for us to continue to be redlined and not have basic things, like we have one bank historically in my neighborhood. They brought another bank in. Great, that was nice. And then they decided we didn't need it anymore. They took the bank out and left us an ATM with a lottery machine. That speaks directly to what they think the value of my neighborhood is. So we are fighting, and we're going to continue to fight. And what people don't understand is that this fight is us, but this is a fight that other people have come out and worked with us on. We have people around the city that are looking at our neighborhood and going, damn, this is not right, what are you doing? And they're coming and they're partnering with us at the table. So the collective effort is so much appreciated and it's valued, but more so because we have young people in our neighborhood still who need to understand that they shouldn't have to go to Niagara Falls to get a job. They shouldn't have to leave and go up to Syracuse or Rochester or wherever. I have a son that had to leave and had to go out to Niagara Falls just to be able to afford to live. If you don't know what it is to have to get to some place from day to day because you have a car, God bless you. I have no disrespect for that. But what I need you to do is get out your car for a day and go and get on the bus. Join us. You want to talk about us, you want to rush us along when we're trying to cross the street, you have no sympathy for what it is that we go through and just trying to live. Park your car somewhere for a day or two. Actually, on a Friday would be great. And then figure out where you are and where you need to get to and find out what it takes. And then come back and let's have a conversation. Because the real is that when you're talking about transportation in my neighborhood, I have a bus that runs off of my corner that stops at 6 o'clock at night and doesn't run on the weekends. So it's either that the thought is that we don't need to go anywhere. Thanks, appreciate that. Or the thought is that we like walking consistently to have to get to where we have to go. Either way, you know, so parking issues, yeah, we're dealing with all of these things. But in my heart of hearts, my true message is that if you say that you want our kids to participate in this renaissance or whatever you care to call it, if you say that you want our kids to see that they're valuable in this city, then why aren't you reaching back to come and get them? That's my that they are valuable. It's not enough for me to say to them, yes, this city has potential for you, when they're not seeing it and they're not feeling it every day. And that's the real one.
You'll be glad to know my law students this semester, when we studied public transit, I told them they all had to ride the bus as one of their assignments. And some of them had never ridden the bus before in their lives. One of them emailed me, do I really have to ride the bus? I said, yes, you do. And she did.
Wow.
All worked out okay. So I'm actually both a moderator and a panelist. So now, in my panelist role, I'm going to talk a little bit about inclusionary zoning and about the report that you have that we put out this past week on why Buffalo needs inclusionary zoning. It's a complement to an earlier report that we were part of, Buffalo Inclusionary Zoning Coalition put out last year, explaining inclusionary zoning, recommending it to the city. This is really just data points in support of that, and it really complements the work that PolicyLink did. So I just want to give you a few highlights. The idea is that inclusionary zoning is a good tool for 4 particular challenges that our housing market faces. The challenges of affordability, of course, but also job access, inclusion, and quality housing. And so I'm just going to give you a few facts on each of those points. Today in Buffalo, more than half of Buffalo households can't afford their rent. Rents have been going up sharply. So March 2011, the average rent for a 2-bedroom was $678. March of this year, it was $1,308. So rents have been going up pretty dramatically in the city of Buffalo. But at the same time, incomes have not been going up. Poverty, concentrated poverty in the city has actually gotten worse. The childhood poverty rate went up dramatically over the last 10 years in the city of Buffalo. So that's obviously not sustainable, to have increasing poverty and increasing rents at the same time in the city. But unfortunately, that's exactly what we're facing. And that's why you're seeing things like the homelessness numbers actually going up in Erie County, not going down over the last year. Job access, the PolicyLink report tells you that only 1/3 of the jobs in our region are accessible by public transportation, meaning you can get to them in 90 minutes or less. So if we're really going to grow as a city, if we really are going to extend economic opportunity, we need access, we need people and jobs to be closer together or linked. So inclusionary zoning is important for that, because where do you see new apartments getting developed? Where do you see these renovations happening and new units being created? Typically in places where there's also job creation going on and or there's very good public transit. So inclusionary zoning is a tool that helps with that. It's not enough just to keep putting affordable housing in high poverty neighborhoods where there aren't jobs and there isn't often good public transit access. The issue of inclusion, you heard the statistics from PolicyLink about how segregated we are. I'll add one to that. In this region, 64% of people of color live in concentrated poverty compared to 14% of whites. Think about that for a minute. About 2/3 of people of color are living in high poverty neighborhoods compared to less than 15% of whites. Think about all the differences that that makes as you're growing up, all the advantages and disadvantages that go with living in a neighborhood of concentrated poverty or one of prosperity, all the extra expenses that your family pays. It's really a big deal. And again, that's why inclusionary zoning is a little different than other affordable housing strategies, because inclusionary zoning says when you put up new housing, X% of those units have to be affordable. So it means that in the new developments, you're going to have truly inclusive housing. You're going to have mixed income housing in those new developments, and that's a tool for inclusion as well. And lastly, housing quality. Our housing stock is very, very old. It's either the oldest or second oldest in the country, with about 2/3 of the units built in 1939 or earlier. Dr. Burstein mentioned the lead paint issue that's so extreme here, the asthma conditions that are exacerbated by living in old, poor quality housing. So again, we need new units, we need high quality units, we need inclusive units that are located in mixed income neighborhoods and mixed income developments, and we need them close to jobs and good public transit. So that's our case in brief for inclusionary housing. So with that, back to moderator role, I'm going to ask our panelists one or two questions, and then we'll get to the index cards. And the first one I want to ask for any or all of you is, PolicyLink mentioned the importance of anchor institutions such as hospitals, such as universities, in bringing the full benefits of economic growth to a city. Would any of you address that and talk about what you see as roles that our anchor institutions could help play in addressing health equity? So,
I know you want me to start. Well, meanwhile, back at the ranch, Johnny has no job. You know, I think that with all of this development that has happened, it's already been established off of Main Street in terms of this medical corridor. There ought to have at some point been a revelation that we need a certain percentage of our workers to come from the communities that are the closest to it. When you're talking about people being able to walk to work, you're talking about trying to pull down the amount of traffic that comes in from cars. Yet we haven't had any of that benefit, and I'm quite sure that not everybody, but a lot of people in my neighborhood would like to work in the medical corridor. I'm not sure at this point how that would have to be structured. I'm quite sure that there would have to be a lot of hands-on work with community leaders to try to put together a program that would benefit, that would work maybe through the advisory council. But I think that it's long overdue. The conversation is long overdue.
And there are certainly some best practices identified in the PolicyLink report about anchor institutions around the country that have had really successful job creation strategies. Jessica, I maybe want to turn to you and ask you, you've said that community health workers are of the neighborhoods that they serve. Can you link that to the idea of job creation and anchor institutions hiring people from the community?
Yeah. Well, I think that, you know, in the space of healthcare, there's a very different kind of conversation that happens around health equity, where we're talking about disease burden, right? So health is the absence of disease in terms of the value system and value proposition of healthcare. And I think we need to get better at understanding their language. They need to better understand ours as well. But I think we need to create more spaces where we understand one another's value systems, and being able to, as activists and organizers and advocates, say, this is going to benefit you. Right now, New York State has a huge Medicaid redesign initiative going on, and billions of dollars are being pumped into creating better health outcomes. But understanding the value system that healthcare delivery has, where they're talking about population health, they're talking about a better experience of care, and they're talking about driving down costs. So things like community health workers and investment in the neighborhood and getting folks who are right in your neighborhood to come into your institution and build up the environment around there, there's a great economic argument for that. I think we need to get better at understanding one another's frameworks and language. I think we have some serious work to do with partnering with and advocating in the spaces of healthcare delivery and understanding what their value proposition is, so that we can have a shared language around things like health equity. Community health workers can be a great tool because we describe community health workers as a bridge, right? So community health workers can go between the community, and we've got some awesome ones out there, many of whom are in the audience, and can go into the healthcare delivery system and understand their language too. So the more that we can have folks like gappers that can understand both sides of things, and some awesome advocates like we have up here today to help get into those spaces and create more ways that we can talk to each other and come up with common solutions, I think that we'll be in a lot better shape as a community.
Great. Samina or Gale, thoughts on anchor institutions, some unfulfilled potential that we might have in the Buffalo region that we could take better advantage of?
I really like what I heard about engaging people. I would go back to the business case and the business opportunity. So I'm learning rapidly that there are a lot of Black-owned businesses, small businesses that do a lot of food-related products, just to use a very minor example. And there are discussions in many institutions, including in public institutions, about changing procurement policies. And typically those procurement policies are thought about as something we have to buy from New York State, or we have to buy from Erie County or Niagara County. But this might be an opportunity for anchor institutions to really scout out what are some locally owned businesses in the neighborhood and think about using their procurement dollars to invest in the neighborhood. So I don't know if that kind of effort has happened, but procurement, institutions are going to buy. Let's invest those dollars locally.
Well, what my idea is that to invest in the community would be, as a pediatrician, investing in the children. And I think I would like to see our partners invest more with the education of our students. And it's not just, it's important to improve the quality of the, the education, give the schools more resources to do a better job, but also, change the environment of the schools. Healthy children learn better, and so, putting systems in place to ensure that our students are physically healthy and mentally healthy. And some of that work has already started in place by, having embedding social workers and counselors in the schools. And we need more of that because they're doing a great job. But also, I'd like to see, and I'm involved in a project with Say Yes to, embed healthcare services in the schools. Many children just don't have access to good health care, especially if their parents don't have access to good transportation to get to a health care provider, and if they have to see a provider for an illness or for stay well with a chronic illness, they'd have to miss a day or two of school to get there or back. So embedding services and really comprehensive health services in the schools, not just doing a physical exam or a sports exam, but really having more, comprehensive health care in the schools and what that would look like, and maybe the buildings structurally don't have room for it, maybe a school link services, and we're looking at that with Say Yes Buffalo. But I think whatever we can do to bring in our community partners, not just the healthcare systems, but business to us, and to invest and enable us to create a healthy environment for our students, to be able to learn better, and to, it's one of the tools that they need to achieve academic success is important. I would like to see happen.
Can I also point something out? With the lack of funding that goes on with Buffalo Public Schools, the thought is that we have to be consistently pulling on education grants, we have to be, you know, all of those areas. I often wonder why we've never thought about how some of this funding that we need can come back from situations like the medical corridor that could, you know, benefit by saying we need to do internships with kids to pull them into the medical areas that we're lacking people in, and at the same time we can benefit the community. I mean, this is simple stuff. I'm quite sure this discussion has gone on somewhere before, but you would think that common sense practices would say, you know, let us reach out to these communities, these east side communities where we know that we have these gaps. Let's put some internships out there to try to fill what we have voids in, and at the same time try to help these communities. I'm not quite sure why that conversation is going to flow back.
Jessica, someone in the audience wanted to advocate for school wellness within the next few weeks. Would they have any opportunities to?
Great one. Great question. Several of us in the room here have been very active in creating a healthier Buffalo Public Schools. I think one of the best investments in health equity in our community would be things like health education. We're looking at the disease burden of our community, and we haven't had things like state mandated physical education. We as parents had to fight for that and file a complaint with the state just to have our kids get the state required physical education. Health education we're still out of compliance with. So we advocated about 6 or 7 years ago for a youth risk behavior survey, which is in line with the CDC tool that PolicyLink mentioned, and looked at the disease burden in Buffalo Public Schools. So if we're not starting with a good, strong foundation for our kids for health equity, we're certainly not going to have a healthy adult population. When we saw the data that was there, and Dr. Burstein mentioned some of the indicators, it was really troubling. Things like teen pregnancy rates, STI rates, and things like violence as well, which we haven't talked a whole lot about. Our kids are really exposed to domestic and community level violence, and it's a huge public health issue. We have to think about it as a public health issue. So we took that data and we advocated for a Buffalo Public Schools wellness policy, and the Board of Education passed it back in 2012. Since then we've been doing things like fighting for physical education teachers, health education, even very simple things like recess, salad bars in the school, getting those good nutrition habits and healthy and whole foods into the schools. The wellness policy needs to be revised right now. The USDA is mandating that districts across the country do that. So we have engaged in a process to help to align that with something called a whole child approach, whole school, whole community, whole child approach. Dr. Baldwin is here from Buffalo Public Schools, who's been critical in working on that. Dr. Burstein has been very involved. We as parents and students and community as well. It has traditionally not been a huge priority to the leadership of Buffalo Public Schools. We've certainly had our advocates there, but we definitely need advocacy. So there was about 10 of us as parents who were at the last Board of Education meeting saying this is something that's really important. We want to see this wellness policy revised. We want to have things that are lifted up a little bit more, like social and emotional well-being. But I think that there needs to be a lot more community conversation and awareness about this framework, which is very much in line with social determinants of health. So I would encourage folks to learn about it. If you are a parent or involved in the Buffalo Public Schools in any way, there are school wellness teams in all of the schools. You can sign up as a speaker and speak at the next Board of Education meeting and let the Superintendent and Board of Education know that this is important to you, and you could talk to myself or Sam about getting plugged into advocacy efforts.
May I supplement? I think it's also important for us to remember that children, when they lead their daily life, they're not thinking about how policy is different in their school versus their neighborhood. They're just going about their life. Right? So they go from their school to their neighborhood, and we know actually children in the city of Buffalo, in some of the neighborhoods, get a lot of what I would call functional physical activity outside of their school because they have to walk to the bus, etc. But many of them don't get that physical activity or other kinds of opportunity because their neighborhoods are unsafe. So if we're going to talk about school wellness, we also have to link it to community wellness, and it has to, that a child's experience has to carry through from what happens inside the school to what happens on the roadside to what happens in their neighborhood. And one thing that I worry about is that right now the way we do policy around health equity is very bifurcated by children's life experience.
Good. All right, well, I'll ask one more question, then I'll get to the cards. And my second question for you is, what can we do in trying to have an impact on health equity to make sure that the people who suffer the worst effects from health inequity are the leading voices when it comes to how we go about changing it? So any reflections you have about that piece of the puzzle, you're welcome.
I was just thinking when the doctor was talking about that particular piece that, you know, we're talking around some subjects. We're talking about transportation or the lack thereof. We're talking about food deserts. We're talking about a lot of things, but we're not looking at how they connect to each other. Because the reality in most children's lives who live in low-wage, low-earning areas, you know, they have to endure going through a school day. You have a parent that is probably on the bus or on the trains trying to transport from one area to the other. I mean, I can tell you for myself, on a lot of days, I'll travel 8 buses a day, sometimes 8 buses and a couple of trains. Now, when you match that with somebody who has children, there's not a lot of space left for someone to say, let's go to the park and hang out and just have some fun, or let's go bike riding or whatever, from a day-to-day kind of perspective. I mean, those things will happen, but they're not going to happen as much as we need them to happen. And so you really have to be looking at how a lot of these things, they're connectors and how they factor together in determining what the child's lifestyle is and why there's a lack. If they're not getting recess, if they're not getting outdoor time in school, and they can't get it after school because there is no resource for the parents to be able to do that, then there is a bigger issue.
Thank you, Denise. Other thoughts?
I think education is critical. And that's top down and bottom up, because policymakers and folks that make decisions, they need to be educated too in terms of how to create spaces that community people can come into. I think, you know, Denise speaks very powerfully to it. If you don't know what it's like to take the bus, if you don't know what it's like as a single parent at the end of the day to have to feed your kids, make sure their homework is done and whatnot, and you're asking people to come to a community meeting, if you don't speak English as a first language and you know there's not going to be translation and interpretation there, we have to do our work to build community spaces. And I'm really happy to see Councilmember Rivera here. We need more policymakers that are engaged in community with us and listening to say, how do we actually involve people here? You know, some of us have done a lot of work in the schools and in healthcare to push into those spaces and say, you can't expect people to give good quality input when you structure it in this manner. So we need to really work to create inclusive spaces. And if we don't know what we're up against, that's why I'm encouraging advocates when we're talking about health equity to understand how the healthcare machine operates, because it is a machine, it is a multi-billion-dollar industry, and there's tons of money coming into our community. So if we don't know what we're up against, we're not good advocates. For our youth to get health education so that they know these are healthy things, we've seen really powerful youth advocates especially who said, I mean, our kids were the ones that got us sex education in the schools, that asked for it themselves, that wanted salad bars, that wanted recess. Our children, we teach them this and they advocate for it and they're able to articulate why this matters to them. So the more we can invest early and often and create inclusive spaces, I think, and listen to one another, oftentimes from different perspectives, I think that we can really start to move the mark in our community.
Great. Maybe Tracey and Anna, do you want to come up now and join the panel, and then we'll get to some of the audience questions?
While we're switching around, I just want to highlight the importance of advocacy. Just as someone that is runs the health department, I mean, we'll beg and plead our legislatures or people with purse strings to to allot money for programs or initiatives or policies that we feel are really important, but if those decision makers don't hear from their constituents and understand that they care and they really want that, I talk till I'm blue in the face and it doesn't happen. So we really need a voice. We need people to scream and let those decision makers know, the policy makers, the people over the purse strings know what's important and know what they need to invest in our community.
Super. All right, let me get to some of your questions now. First one is, why is there no conversation about the history of health and race? When do we acknowledge that this is all intentional? So, panelists, thoughts on
I'll start. I don't know if the implication was today or ever. I will say that we definitely start the report that way. This isn't the question. The person who wrote it, it's exactly right. That this is not a failure of policy. This is what policy was designed to do. This was all by design. I think that it often, when we try to have conversations about race and racism, it makes people uncomfortable because they think that you're trying to blame people. So if we talk about, well, there's racism against black people in Buffalo, it sounds like you're saying, well, then that means the white people must be to blame. The systems are what's to blame. White supremacy is to blame. But so I mean, I've had I'm going to say something I don't entirely mean right now. So I don't care if you're actually racist in your heart or not. Like, I don't care. I care if I don't care if I'm blaming you. I mean, it's like I'm not interested in having debates over who an individual, whether they're racist or not. I care about whether or not you want to address the racism in front of our eyes, And so, but that's why I said I don't mean it, because I didn't care if you're racist. But my point being, what I'm most concerned about is the fact that we are reinforcing institutions that are harming people. And so I think that the conversation does get complicated because it feels like there's a blame game, there's a boogeyman, there's something that we have to put this all on. The truth of the matter is that if we're allowing these institutions to continue to operate, then we're all complicit, right? Regardless of that, we're all complicit. That's why the folks that are putting their necks on the line and doing the work for it are, they're the ones really like leading the battle because they're addressing these issues head on. I almost said race on, head on. So I do appreciate that question because it really is a part of our focus here. We are a organization that focuses on racial and social justice issues. And so, yeah, I think that it would be really brave, particularly at a moment where you all have an African-American mayor, to have some bravery around talking about race and the legacy of racism in this city.
Thanks, Tracey. Other comments on the role of race and health?
Our mothership, the Centers for Disease Control and Prevention, is for public health is really, maybe in the past 5 years, started to embrace the concept of health disparities by race. And so I think that's really helped us, given us permission to start having that conversation and start talking about it. And when I talk to my colleagues in health, it feels a little bit uncomfortable about it. It's outside their comfort zone. But again, I think we have to talk about it. How do you normalize the concept and talk about it? And so we've started to have those conversations. But I think until people can really talk about it and admit that it's there, and then go into the next step to be able to address it. And again, it's looking at the social determinants of health. That's really predicting what our health outcomes are. I think we have to continue having these conversations and just raising awareness and making people feel comfortable that this is a problem that we have to address rather than blaming.
I just want to say, I think, excuse me, my throat is, I guess my voice is going to be going soon, which is fine. I haven't screamed enough. I think that it's important to note that as long as we keep talking around these things, that's why we keep having these conversations. It's like a never-ending discussion because we never ever get to the heart of the matter. It's like we're scared to say the thing that's most important to talk about. And the conversation just continues to swirl around all the time.
Thank you.
Unless, go ahead, please, first. Well, I'll try to say this quickly then. I wanted to add that I'm glad you brought that up because I think there's also an impulse for people to say, well, let's talk about economics and not race as if it's a proxy. But we know that, at least nationally, the average African-American family making $100,000 a year lives in a worse neighborhood than the average white family making $30,000 a year. And so the way in which our neighborhoods are designed, the fact that Black people for the entirety of this country's history have been prohibited from living in certain places. That means if you're lucky enough to have a home in your family and pass it down, even if you make it to the middle class, there's a chance that you're living in a neighborhood that is not conducive to your health. So if we're talking just about income, we miss that part of the story. And so people often will say, well, let's talk about economics, let's talk about income levels, because it feels a little bit more comfortable and they're hoping that captures race, but it doesn't capture racism, which is agnostic to how much you make.
Crucial point, and worse here than most places. I gave you the statistic earlier, 2/3 of African Americans living in high poverty neighborhoods here in Buffalo, Niagara.
I just want to maybe supplement what Tracey was saying, that it really is not just about economics. We have data to show that in Buffalo. So to go back to food as an example, when you control for income, when you control for wealth of neighborhoods, so again, I'm repeating myself, but I think it's worth repeating. Pick two neighborhoods on average, one Black, one white. With the same level of income, the Black neighborhood will have less than half the number of supermarkets than similarly level income of a white neighborhood. And the numbers are somewhat similar for other neighborhoods of color, but it's especially true for neighborhoods that are predominantly Black. I think it's also important to point out that it is sometimes, maybe I think you were alluding to this, Tracey, that sometimes there is a way to be silent in policy. So we sometimes think that we're talking about silence, so if you didn't step up and say something about race, but really we have to understand that policy can be silent and blind on race. And that's in some ways, I would say, personally to me, more dangerous than you stepping up and saying you're not racist or whatever. And that silence of policy is harder to actually pinpoint because policy is not like this cup. You can't actually see it and touch it. It's a structure that impacts our life. So I think being able, for the advocates to be able to explain to those in positions of power how policy impacts their life is important. But I think for policymakers, and I'm going to put David on the spot, although I think he understands this well, it's important to know that there is no such thing as a neutral policy. When you make a decision about a zoning setback, something even as simple as that, you are making a decision about race.
Tracey, this one's addressed to you, but I'm sure we welcome other thoughts as well. Question is, one of the things I noticed most about this room is who is not in it. How do we move this policy agenda from ideas to action and get buy-in from our elected officials?
That's a great question. So I think probably some of the people that aren't in the room are electeds. And I don't know if anyone here is from any of the health institutions that we have mentioned. I think part of it is that when I've gone to different cities, it's often challenging for city leaders to participate in an initiative or coalition when they're not in charge. They feel they don't almost know how to function. No respect to Councilman Rivera because you're here and you're obviously taking leadership, but I think that sometimes it's hard for elected or agency heads to be part of a coalition if they're not leading it and dictating where it goes. It's hard for them to be a partner. I think that while I think that coalitions also can be compassionate and carve out a role and say this is what we need and be very specific because I know I have an impulse as a resident of a city going through a lot of changes to just kind of attack where I see the shortcomings of my city. But I think that it does go a long way to say, well, if you can do these specific things, that would be helpful. And so that's something that we have been talking, we started talking about this morning with our partners at Open Buffalo about getting clear on what is it that we think we're doing. If it's about stopping gentrification, or if it's stopping something, let's be really clear what that is. Let's talk about what data we need to measure that. You know, what are the indicators? If we say we're going to stop gentrification, then we need to start, you know, knowing how many homes and how many people are at risk of being displaced. How many homes are we going to keep together? How many people in the neighborhood are unemployed and we need to get connected with jobs? Having a better sense of what's going on so that we're accountable to what we say we're going to do. So I think a lot of people will say, I care about gentrification, and then do policies that don't represent that. I think if we're clear about what we're going to do, how we're going to measure what it is we say we're doing, then it keeps us all accountable, and hopefully different leaders can see themselves in that process. So I think it's about moving away from some of the visions that we all have. There's lots of, I think that even, you know, some of the institutions that have been challenging to work with have a similar vision. They might say, we care about all people being able to prosper, and we care about everyone's health. But I think that once you start getting from vision to what's actionable and what it actually takes, that's going to hold them accountable. So, you know, are you actually, do you see yourself in that plan, or how are you in this plan?
Okay, anyone else want to comment on that?
You know, I have to say this because it's killing me a little bit. Another one of the problems that we have is that when we talk about historic neighborhoods such as mine, when you're talking about the value of a neighborhood, you're not just talking about the people. You're talking about the buildings. I have a house that's 120 years old, and it's a beautiful house. And the houses that are around me that have been there for a very long time, that stand strong, you know, I have a hard time trying to explain to my kids why it's all about the new development. Why are we not looking at what we have in terms of, you know, the houses that were put up and built to last, and investing in them? We're talking about things like lead, and that's great, but you don't demolish a house because it has lead. You have to find the way to fix the problem and still keep the structure and keep the reflection of the neighborhood. When we're talking about policies and the way that things are put together, you know, that's part of the problem, is that we want to tear stuff down, we want to just bulldoze it over, we want to move on, and let's see something that's bright and shiny and pretty, and that's great. But where's the conversation that says we have value? If this is a city that we bring people in for tourists to say, oh, come downtown and look at all of these wonderful buildings that we have, but we don't see the value of our neighborhoods that have been enduring, and look at the houses that are still standing and say, how do we continue to invest in that, make sure that they stay where they are, and invest in those neighborhoods? That's a conversation that's not going on. And that's one of the reasons why we have so many of these empty lots.
Yeah, that's a great point, and I'll just highlight that by saying that from an environmental standpoint, it's, you know, almost always better to keep an existing structure rather than building a new one. But also economically, if you look at the experience of housing nonprofits in Buffalo, like a Habitat for Humanity or a Push Buffalo, they find that a total gut rehab is substantially cheaper than new construction. So environmentally and economically, saving those old structures makes a lot of sense. Time for one last of these questions before we break. And this question has to do, one of the audience members is wondering, a lot of the initiatives that we're talking about are grant funded. What are some strategies for sustainable long-term progress toward health equity that go beyond sort of grant-funded projects but have their own economic drivers, I guess you'd say? So, yeah, Jessica.
Yeah, I think looking at the amount of money that's invested in healthcare is really important, and to know the mandates around where that money is coming from. You know, we do have a medical school, we do have public health infrastructure, and that needs to be invested in. we look at the numbers in terms of what we're investing in healthcare versus public health, they're pretty dramatic, and it's unlike any other industrialized country. So I think we need to understand and as Dr. Burstein said, advocate for more public health dollars and more government funding to go towards a lot of these efforts, because we're constantly as advocates patching stuff together and fighting against these policies, but there's this overarching policy infrastructure that's in place that has us always fighting. So we need to try to push more of the stuff that's downstream investment. You know, people are sick and unhealthy, and we keep trying to pull them out of the river, and it's extremely costly, right? So those healthcare dollars that are taking care of sick people could be used to build stronger public health infrastructure. Most people don't even know what public health is, right? So we need to invest in a more robust, I mean, it would be great if Gale had a whole army of community health workers, right, in the public health department. Or we've gotten some grant funding from the Community Foundation to have a pilot program to train parents and students in Buffalo public schools as community health workers. We cannot get investment from Buffalo public schools to scale it up, even though we've researched it and shown how effective it is. So we need to, I think, on a national level and a state level, work with, in the city level too, try to push some of these resources that are going towards healthcare delivery and building buildings and hospitals and push them back into the community and more of a public health, social determinants of health type infrastructure. Otherwise, we're trying to patch it together. And I think work with our partners, work with places like the medical school. We've done some cultural competency training and some other projects with the medical school. New York State Medicaid redesign has several rounds of funding and infrastructure, and we need to know where that money is coming from and where that money is going, so we can try to redirect some of these resources to where we know they need to go.
So I'm going to throw out a couple of ideas that I know they're not being used in Buffalo, but maybe there are some college students who can carry them forward. These are ideas that have been used in other places, and there's an opportunity to maybe consider them. Public finance follows a set of rules about how taxes get levied and how those monies are then expended. There's a whole bucket of revenue mechanisms that go into the city's budget. Property tax being one of them, but not the only one. Increasingly across the United States, we're seeing local governments are really resource constrained, so they're using a lot of fees and licenses, etc., to supplement their coffers. And on the expenditure side, there's the usual stuff, you know, police and education, etc. And there are some mechanisms that local governments have used when they have found that their public finance doesn't really quite work when it needs to address some of these thorny issues. So some examples are that in one county in the US, they decided that any time there would be a development that would take away land, that when that sale happened, some benefit from that sale would be captured and put into a fund that would be specifically used for investing, in this particular case, in food infrastructure. And it was the only one of its kind that I knew about. Another example, we routinely establish business improvement districts. Nobody raises an eyebrow. There's nothing to say that we can't model something called a health improvement district or health equity improvement district. We routinely uphold, including in every part of the U.S., the idea of a development impact fee. If you generate more traffic, you're going to make our roads get used more, therefore you ought to put some money into our coffers for roads. But if every time there's a development and it generates traffic and it causes my kids to end up in the hospital because pollution is high, that externality could also be captured through a health impact fee. So I've advocated for food impact fees in other places. I would say in the context of this panel, there might be some room to consider options for a health impact.
Fantastic. Yeah, that's great.
So just thinking about, how do we make systems changes in health to enable us to, to live healthier lives. And, we invest so much money right now on the downstream of health that we invest, billions of dollars and keeping that person alive for 1 more month in the intensive care unit when the quality of life isn't really great in the first place. And there are a lot of people that financially gain from that strategy. And so, but then there are a lot of people that lose out because they don't see the benefits from resources that we need invested to to maintain wellness and to encourage wellness. And I started my medical career actually working in Southern Africa in very impoverished areas, and I was just so impressed by how much you could do with just so little, and trying to take that model back here has been extremely frustrating. So just thinking about reprioritizing and where we put resources, and I know we have a strategy of Medicaid redesign, but still the hospitals still own the purse strings. They're funded to redesign Medicaid, and I mean it's intuitive that there's a conflict of interest. So again, thinking about how we can really make real systems changes to improve our health and make sure the investment goes to the people to keep them well instead of a few people to at end of life care, which may not keep them well or feeling well and a good quality of life during that time.
All right, we have run out of time. Please join me in thanking Tracey and Angel and all our people.
I want to thank everyone for coming, for our panelists, for Angel and Tracey being with us all the way from the Bay, for Sam moderating. And I know that we had just a couple hours, very brief, but we'd love for you to continue the conversation in the room next door. We have coffee and light refreshments, so you'll have time to interact with the panelists and some other folks and continue the conversation. So thank you so much. And if you go to the National Health Equity Atlas of this morning, Buffalo's been added, so please check out the full report and see it much more in detail there. Thanks, everyone.
Thank you. Thanks.